Here we go. Happy afternoon. Good afternoon, everyone. This is Dr. Nadia Monique Johnson, founder and CEO of the Black Women's Mental Health Institute. And this is our weekly Voting Matters to Our Mental Health social media live conversation. As you may already know, our organization has a Voting Matters to Our Mental Health campaign that we really rev up every presidential election year. And it's an opportunity for individuals to get connected to resources, understand their role in civic responsibility to vote, but also to be empowered and knowledgeable about how they vote and where to get the resources they need. A big part of the Black Women's Mental Health Institute that supports our growth and our impact are regular partnerships with other phenomenal nonprofit organizations that are doing work, really great work. So that's what makes me excited about today's person who is on for the discussion, Miss Robyn Hyden, who is the executive director of Alabama Arise. And so, Robyn, with these social media live conversations, we are formally informal. We jump in, we dive in, and we have conversations. So thank you so much for making time to be here. And let's jump in. Why don't you just start off by letting us know the mission of Alabama Rise and the type of work you're involved in?
First of all, thank you, Dr. Johnson, for having me on. I will always take time out of my day to speak with you. And I've been watching you build the Black Women's Mental Health Institute as long as I think I've been in this role. And what you have built is just an incredible powerhouse. So I'm truly grateful to be in partnership with you as we talk about public policy and advocacy. So a little bit about me. Yes, I love you so much. I'm so grateful for you and the work you do.
Same.
It is just life-giving to see the connections that you're drawing between our health, Black women's health, and civic engagement and voting. So it is election season, but I work for a nonpartisan nonprofit coalition called Alabama Arise. We've been around about 37 years, and we're faith-based, civic, and nonprofit groups and individuals united in our belief that people in poverty in this state are suffering because of state policy decisions that are made here in Montgomery. So much decision-making power lives here in the state capitol. And, so there may be decisions that are made in DC that actually end up getting blocked at the state level because of leadership here in Montgomery. There are decisions that need to be made at the local level that you would think your city councilor or your mayor could do that actually get blocked here in Montgomery. So that's why we feel like we're a voice here, uniting partnership to say, we're going to use some policy analysis, we're going to monitor legislation, we're going to bring together our membership to build a proactive agenda to bring to lawmakers and say, what can we do to make life better for people who are struggling and marginalized because of economic injustice, because of poverty? And there are so many connections here to mental health and well-being, but the issues we work on are not just health issues about health justice and health equity. We also, we work on expanding Medicaid. We work on untaxing groceries at the grocery store. We work on funding for public transit, people being able to get SNAP, TANF, or WIC benefits to support their families, summer EBT benefits for kids. Voting rights is a huge body of work for us because we believe that if I can't decide my own representation, if I can't engage in the political process, I'm disempowered. And power is actually a social determinant of health. So there's so many aspects to policy work that relate to voting.
And one of the things I appreciate about your work is while we're a mental health organization, right, we're focused on those things, increasing access to care, making sure that care is culturally responsive, the whole nine. We find ourselves in those spaces, right, talking about equity in housing, equity in education, equity in employment, because all of those things are connected to mental health. Like we can provide service, we can make sure that someone has access to a therapist, a psychiatrist, a psychologist, what have you. you. But if we're turning them right back into communities that are disadvantaged, that are blighted, that are lacking in resources, that's going to have a negative impact on our mental well-being. So we're always trying to make sure that our communities are structured in a way that where they foster our mental health versus threatening it. Because if I have a mother who is struggling with all of those things and then she goes back into her community and she cannot find a job, she doesn't have proper transportation, and her kids are in a failing school system, all of those things are going to wreak havoc, and all of our counseling is going to be just to maintain her, to persevere through those things where we just want to remove those barriers altogether. So again, one of the things I appreciate about y'all is how community centered you are in your advocacy. You don't just take the time to engage and build relationships with elected officials, which is important and necessary for the work. You empower residents to get involved, and you partner with them and you bring them on board and you equip them so that they can do the same things for themselves. And one of the powerful ways that you do that is through your advocacy day. I didn't make this last advocacy day, but I've been to these events. They are very empowering. You learn something every single time. So can you talk a little bit about what your advocacy days are and what they're about?
Absolutely. We believe that state policy is not effective policy if the people most directly impacted are not engaged. If the state house is the people's house, and so we want to be eyes and ears and bring people directly in there to see and hear how the process works.
Mhm.
So we do have an advocacy day usually in probably late March, early April. We haven't set the date for 2025 yet.
Mhm.
The legislature starts meeting in early February next year, and we bring our agenda to them. And then we bring all of our members and partners who want to join us, usually about 200 to 300 people, to go walk the halls and sit down and meet with their elected officials.
Mhm.
And it's always a little bit chaotic. It's a lot less formal and professional than one would think that it would be. You can just kind of walk into your lawmaker's office. I think that shocks a lot of people who've never been there. They're
Mhm.
just regular folks. And
Mhm.
and the thing I would encourage is if you've never been able to come to an advocacy day, whether it's Alabama Rise, whether it's any number of other advocacy days that happen throughout the legislative session, once you meet your legislator, that's a relationship that we want you to hold. Whether you vote for this person or not, they're up here voting on your behalf. They're representing you and their district, your whole district. So we want you to recognize them when you're in the grocery store or when you're pumping gas, because you should be running into these folks at community events. And their point of view on what is important to their district is influenced by citizens. I
Sure.
think this also shocks people. I think there's a perception that if you're not a lobbyist with hundreds of thousands of dollars, you're not going to be able to meet with your representative or they're not going to listen to you. But we have found that if we get just 10 people, if you just round up 9 of your friends and call a lawmaker about something, suddenly they are calling us to ask, what can we do about this? Their point of view is shaped by you. And I think the fact that so many people are not engaging with their state lawmakers means that we let them get away with too much stuff.
Sure.
Even folks who ran on policies that we think, oh, they've got it covered. Well, what we're here to do is help you monitor and really make sure that, hey, I think my legislator cares about this, but I need to make sure that they know that I care about this.
Mhm.
So we try to make that easy, even if you can't drive all the way down to Montgomery for a full day. We want it to be accessible. We want you to be able to live stream the meetings or get updates on them after the fact. We want you to get an alert when a bill that may be important to you is being voted on.
Mhm.
And then we want you to have access to that information because you laid out so many huge problems that are facing our state and our communities. And there are opportunities every single year to make progress,
Mhm.
to just chip away at maybe we can improve this one thing about housing. Maybe we can get a little bit more funding here for school food or for transportation.
Mhm.
So that's why I think it's so key that if you've never come down here and walked the halls of the State House or even met with your legislator, like, don't be intimidated. Well, first of all, they're asking for you to vote for them. So they're going to be responsive to you. They should be.
Mhm.
Um, and if they're not, organize your friends and make sure they hear about it.
Sure, absolutely, absolutely. So I had the opportunity to do to moderate a panel discussion on Monday. It was for the Birmingham Junior League, very engaging. One of your colleagues was on the panel, Mike, who is one of your senior policy analysts. Something that came out of that community conversation was a need for civic education, and we talked about it from the K through 12 setting, even the university setting. But even for, individuals who are not in a school system, not at a university, really a lot of everyday residents are not fully aware of the different ways that they can engage their elected officials on a national level, on a regional level, on a state level. So if you had the opportunity to talk to a resident who didn't understand that Biden is not responsible for the potholes in their neighborhoods, right? If you had to really break it down into sections and levels for just a layperson, a resident in the community, how would you break it down in regards to how they engage individuals and what they would be engaging them for?
This is actually the biggest barrier I see to civic participation. You're absolutely right. It is hard as a regular citizen, even someone who I thought had pretty good civics education in high school,
Mhm.
to
Mhm.
really remember who does what now and what. And so identifying who is responsible for the the issue takes
Mhm.
a lot of time and energy. One resource Arise has is we have regional organizers who live in North Alabama, Central, and South Alabama, that if you want to join Arise and just like invite someone out to meet with you one on one or have a Zoom conversation, have a community, like just have a little forum in your Sunday school class, in your kitchen, wherever it is with
Mhm.
your partners, we can come do that and talk about, like how you map that out, because there are some great fellowships and trainings out there for folks who really want to get engaged. But if you just need like entry level, I would say think first about, you know, items of concern in your own backyard.
Mhm.
The first person you need to be calling is your mayor or your city council person.
Sure.
And you need to ask them, hey, what's going on here? What's up with the potholes?
Right.
Why isn't the library open past 5 p.m.? Why
Mhm.
does the bus stop running on the weekend? Um, that's where I would start with a lot of these local problems. Local school boards have a lot of power.
Mhm.
So who represents you at the school board and makes these policies?
Mhm.
If you call them and they say, hey, it's out of my hands, that's Montgomery, that's when you need to go to the state legislature. And there is a surprising amount of control for local issues at the state level.
Mhm.
So that's where you may plug in your address into a tool that helps you find your representatives, and they'll first have the president, and then
Mhm.
they'll have your members of Congress and your U.S. senators. Then they'll get to the state legislators, and I think a lot of people forget about state legislatures.
Right.
They are very, very important. The state of Alabama has its own constitution. It has
Mhm.
its own Supreme Court. And even if it's been a while since you had civics, there's, bills have to become laws in Alabama the same way they become laws in, the federal
The
level.
federal
So
level. Mhm.
that is where we focus a lot of our time and attention at Arise, because again, there's so many things that even if, let's say you moved here from another state, you may be surprised by how much control the legislature has. In fact, a
Sure.
lot of people who end up joining Arise, they moved here from out of state and they were so shocked by things that were different here
Mhm.
that they
Yeah.
wanted to investigate more, like, why is that? Why isn't it the same in Alabama?
Mhm.
And then, I think most people are very aware of Congress and the president. And that's where I think, there's cable news media, there's social media, there's a lot of awareness of, what Biden is doing or what Trump was doing. And we can influence our members of Congress and our US senators as well.
Mhm.
But keep in mind, every level you move up, that person represents hundreds of thousands of more people. So if
Mhm.
you think about your relative ability to influence someone, if I'm reaching out to my city council person, it may only be a few thousand people that they represent. they
Mhm.
really value every single vote and every single, member of
Right.
their district. You move up to state legislature, it's more like 50,000 or more people that they might represent. So
Mhm.
suddenly, but still, they're going to be much more responsive to you. The House of Representatives member might
Mhm.
be.
Mhm.
If you move up to the U.S. Senate, they represent the entire state of Alabama. That's 5 million people.
Mhm.
So that's where I think if you truly have identified an issue in your backyard and you think you have no power, I think you're underestimating yourself, because those local elected officials and local state legislators, city council people, um, they're in your backyard, and you need to view them as a resource. And again, I know it can be overwhelming to figure out who is responsible. So that's where groups like Arise hope we can come in and help make those connections.
It can be overwhelming. It can, especially again for an everyday resident who doesn't even fully understand policy and may be intimidated by it. So I think that's going to be my next question. When it comes to policy, where can individuals go? Where would you direct them to, first of all, see them, but then read them and understand them, and even have it broken down into language that it isn't so, I don't want to say convoluted, but isn't so difficult for anyone to read. And when I say this, I think about public health promotions, right? When you're putting a flyer together, when you're putting a documentary together, there's a strategy that they have where the language is broken down to almost a sixth grade reading level. And I think that that's something that we can be blind to sometimes, is this idea that everyone has access to an education that would equip them to really read between the lines and understand what a policy is saying, versus having nuggets and bullet points that say this policy is addressing these things, which is much more easier to digest. So where would you direct someone, an everyday resident, maybe someone who didn't go to high schools, maybe someone who didn't go to college, even some people who may have gone to college but still don't fully understand all of these very lengthy, wordy policies? Where would you go to? Where would you direct someone to just get the snippets and the bullet points of these things, so that they can get the talking points, well, the understanding, but also the talking points that they need to engage their elected officials?
Yeah, and that's a great question, and that is the constant struggle.
Mhm.
We are working a lot. I would urge you to visit alabamaarise.org. We have a lot of free policy resources and tools there for our priorities, and we're always working to make those easier to understand and follow. We spend a lot of time putting out videos, especially leading up to and during legislative session, to just recap what happened. I know, even I eat, sleep, and breathe public policy, and I'm exhausted at the end of the day. I don't want to spend 10 minutes trying to read a convoluted report. So I think about the media I consume. I like video, I like audio.
Hmm.
And so we try to put out those tools for our members. So if you'd like to join Alabama Arise,
Yes.
we have members only resources, and we also have action alerts that are available to everyone. So if you just need an intro to say, I really just want to start engaging more on healthcare advocacy or hunger advocacy, criminal justice reform issues, sign up for our list at alabamaarise.org. And what we'll do is, when a policy is introduced and we think it's something that's really good or it's something that's really bad, we'll send you the alert and hopefully make that language as clear and easy as possible for you to be able to speak about it. You don't have to be an expert. The thing is, lawmakers are not experts. They're just some person who hopefully has a public servant's heart, and their expertise may be in one area. It might be in business, it might be in law, but you are an expert on what your community needs. And so when it comes to things like affordable housing, healthcare, hunger, it is so powerful for you to reach out with an email. We will draft the email for you. We'll put the bullet points in the email. This is the bill number. This is when it's being voted on. This is what it means. And then you can add your personal story. I think that's where we come in as experts, right? Like, nobody can tell me what my personal experience is.
Sure.
Um, and often I think those things are really moving to legislators. We spend a lot of time putting together the facts and figures, the economic impact, comparison to other states. Often that's persuasive. If Georgia can do it and Tennessee can do this, why can't Alabama do it? But then it's also persuasive for them to hear, actually, I live in your district, and you may think that everyone in your district is doing well and nobody struggles, but I had a mental health crisis and I was unable to see a doctor. Here's why. Or my hospital closed and now I have to drive 2 hours to get prenatal care and I'm scared. Lawmakers need to hear those stories because they review thousands of bills every session. They may or may not really pay close attention. Those are the things that capture their attention. And then I will just say there are other groups other than Arise. We don't work on every advocacy or policy issue, but there are great advocacy partners around the state who work on LGBTQ inclusion, gun violence, community safety, other issues that they're equally as passionate. They have training opportunities as well. We can't organize ourselves enough and teach each other enough that, the more citizens who are engaged, the better.
Sure, absolutely. And something I appreciate that you just said is that you are a nonpartisan organization. So when you're sending out these alerts, they're not necessarily on party lines. So when you're sending out alerts and you're saying to your membership, this is good and this is not great, it's really in regards to the impact that it's going to have on the community and especially those who don't have access, right? Especially those who are maybe in more rural maybe areas. Am I seeing that correctly?
Yes, that is true. And, I think often this is where people become very frustrated and disenchanted and just want to unplug from politics and policy as they see it's so partisan, it's so ugly, it's divisive. And there is a lot of ugliness going on in Montgomery and in DC, there's no question. We try to focus on, okay, all of that, knowing all of this, where can we still pass good, solid policy? Because I don't care which party you are affiliated with. If your hospital closes, that is a huge concern to you.
Sure.
If kids in your community are not able to eat and they end up in a school to prison pipeline, that is a concern to everybody who represents that district. So we always, it doesn't matter if it's a Democrat or a Republican, they're with us on some issues. They may be not with us on other issues. For us, it's about the policy, not the personality. It's not about politics. And that's the spirit in which we approach our advocacy. So, it's always disappointing when people feel shut out and not heard or represented by their elected official. And I know that can be very dehumanizing and disempowering. Our goal is really to give you backup to know you're not alone. If you want to go speak to that person, we have surprising allies on all kinds of issues from, we've worked on payday lending reform in the past. That's definitely an issue that you cannot predict based on someone's party affiliation where they come down on that issue. Medicaid expansion, increasingly, we're finding, hey, we're not going to get this done without Republican leadership agreeing. And we have surprising allies on that issue because it impacts every district. So we do look for the bright spots of opportunity. We can't win them all, but we win some surprising things.
Yes, absolutely. So here's another question I want to ask, and I think that I'm in the learning process of this, so I will put ourselves in this conversation. Our organization is a 501c3. Because of that, we specifically are able to lobby. We have nonpartisan approaches to all the things that we do. We have to be very careful so that we can maintain our tax exempt status. However, I've always had a passion for understanding this because we do all sorts of programmatic intervention, and that's great and that has impact. But oftentimes, those programmatic interventions are a response to a condition that is impacted by policy, which means policy has the ability to change whatever environment that might be inequitable that this programmatic intervention is trying to resolve. So because of that, as our organization grew and our reach and our impact started to grow, I realized that we could do all the programming in the world, but if we don't address policy, we're going to keep having to do these programs. I want policy to put us into a place where these programs aren't necessary anymore. I was at a conference in New Jersey, and I'm actually going there again next week for this year's conference, and had the opportunity to speak to a lawyer who assured me, he's like, you are 501c3, but you can still engage your elected officials. You can have a relationship with them, and you can take them data. And it's not lobbying; it's educating. And that kind of piggybacks on something you said too, is that these elected officials are just people who don't have an expertise in everything, right? So they may not be versed in mental health and the challenges of mental health and how they impact everyone, but also how they specifically impact the lives of Black women. So by capturing data, going to them with essentially talking points, and educating them, you're not saying to them, vote for this or vote for that or vote for this. You're saying, take this knowledge and consider it as you're making your decisions on whatever policies and things that you are voting for and thinking through. Use that data to make your decisions. But what I'm also finding, and again, we were just in this boat, that most 501c3 nonprofits don't know that, right? And so they are not involved and they're very reluctant. How would you, because I'm sure you're partnering, well, we've partnered a lot, you partner with other 501c3 organizations. How would you encourage them to step away from that hesitancy and say, yes, I could be a part of it and still maintain my tax exempt status?
That is such a great question. And I do think there are a lot of misconceptions and a lot of real understandable caution around this. But I do think it is important to note that you can lobby as a 501c3.
Mm-hmm.
So there are clear guidelines. I think this is where people get nervous and think, I just don't want to fool with this because I don't want to risk breaking the law. But as you noted, first and foremost, education, 100%, anybody can educate their lawmaker.
Mm-hmm.
You don't have to register to be a lobbyist, to meet with your legislator and just say, here's who I am and what I do, and here's what I want you to know about what I do. That is hugely, hugely important. And what you said is so true. If you lead a nonprofit and you're not engaged in advocacy, you are missing a huge part of your mission, because it can, public policy can come in and undermine every single gain you might make after years of work. And it can also boost your mission impact if you get one policy passed that suddenly you can amplify your work, even more. So all of that said, you cannot do electoral work as a C3, meaning you cannot endorse a candidate. You can't engage with political parties or partisan politics.
Mm-hmm.
But if you do issue advocacy, especially that is in line with your mission, you can educate a lawmaker and say, because our mission is to enhance these areas of concern, and there is a bill related to that you are voting on, I would urge you to vote yes. This bill for these reasons. And actually, that's perfectly legal. And if you're concerned at all about this, feel free to reach out to someone at Alabama Arise. There's also a resource organization called Boulder Advocacy, BOLDER Advocacy, that has free legal advice for this. And it is very well established. We are a 501c3 that lobbies a lot. All of our member groups are almost all are 501c3s who advocate and sometimes lobby with us. As long as it is not a huge portion of your budget, meaning you're not spending more than 10 to 20% of your budget on lobbying, which most groups would never get close to that. Because think about it. How much staff time does it take to make a phone call, or send an email? It's nothing. It's an insubstantial part. That's the legal term, an insubstantial part of your budget. So I did want to reassure you on that. That is a major roadblock to a lot of nonprofits engaging in advocacy. is real
Okay.
fear over lobbying. And I will say that the Alabama Association of Nonprofits is another great resource on this. I
Mhm.
know that Danielle Dunbar, their ED, is passionate about advocacy and lobbying as well. And she has a ton of resources about this too for those who go through their leadership training. So
Mhm.
truly, do not be afraid of the L word, which is lobbying.
Mhm.
But I understand there are other reasons people may be afraid of lobbying. Either they receive state or federal fundings that do tie your hands.
Sure.
And that is a real concern that people have. You can still advocate as a private citizen. So you don't do it
Mm.
on the clock, but you may go home at night and say, gosh, I'm really worn down from my day job as a mental health counselor, as a teacher, and I'm so fired up about this issue. You can still share your personal experience as a constituent and say,
Mhm.
I think you need to support this. Here's
Mhm.
why. Here's what I see. You don't have to speak on behalf of your organization to do that. Um, we find though that the most powerful advocates are those who are practitioners.
Mm.
So all lobbying is one, you educate a lawmaker about a bill, and two, you ask them to take a certain action or position on it. That is what makes that lobbying.
Mhm.
Um, there has to be a specific bill, and you have to name it and ask them to do something.
Okay.
And otherwise, it's just education. And
Mhm.
so I'm so passionate about this because I came up as a working in multiple nonprofits. I worked at the United Way of Central Alabama. I worked at Urban Ministry in Birmingham, and these were all organizations that actually I still was able to engage in advocacy as an employee
Mhm.
because my employers really understood that, hey, if we don't let lawmakers know that this program is federally funded and this is the impact it has in our community,
Mm.
we may lose a whole, $1 million program that is saving homeless veterans. That was a
Sure.
real issue. Or, I worked at Alabama Possible, which does a lot of work on education access, educational attainment and access. Well, a lot of the programs they work on are federally funded and
Mhm.
subsidized. And so, um, if your work is at all related to state or federal funding, it is totally your right as an employee and a citizen to educate and inform your representatives about the value of that work. And again, I understand nonprofit directors and leadership may have reservations, and that's where I think some more education can be helpful.
Okay, that is actually incredibly helpful. We might have to do a whole other, weekly discussion solely about what nonprofit 501c3 organizations can do and things to be mindful of. So I'll get some of those resources that you mentioned from you. So we're gonna wrap up. We've had a good like time goes by really fast, right? Like it's already been a good 30 or so minutes. So I want to ask you if you have any closing thoughts. And then after those thoughts, I've got one more question for you.
Sure. I've talked a lot in like the abstract here about how important it is to share your personal story and your experience with your lawmakers and elected officials. But I think in practice it's really hard. So I just wanted to share my personal story and what I say sometimes when I meet with lawmakers. Um, so I have three different major issues that I'm so passionate about. One is mental health. My husband has a serious mental illness. So often, I actually, if I'm advocating on mental health, I may talk about that and my experience that even though my husband has a serious mental illness, we've struggled sometimes to find care for him, even with health insurance, because of decisions our state has made to not invest in our healthcare infrastructure and mental health.
Mhm.
Um, I have a story related to sexual assault awareness. I had
Mhm.
a really close friend survive a sexual assault, and I saw how much institutions failed to support her and other people in that situation. Um, and those are hard stories to share, with elected leaders. They don't hear those a lot.
Mhm.
Um, and the third thing, and this is what I'll say right now, is I'm very passionate about maternal health care and
Mhm.
reproductive health care. And, I had a child earlier this year. I ended up having preeclampsia and giving birth 3 months early. And thankfully, my son is doing really well. I had a relatively safe delivery, and he was in the NICU for 90 days before coming home. And so I'm so grateful we had access to that care. I was able to see a doctor for a routine checkup, get caught very early that I was at risk of having a stroke and I didn't even know it.
Mm,
I was at risk of losing my child, and I was able to get into UAB and get some of the best care you can get in the whole state.
mhm,
But when I think about that, I think about all the other women who don't have that privilege. I had to take a whole day off work to go to my doctor in Birmingham.
mhm,
My
mhm,
husband came with me. I was able to take 12 weeks off work for paid leave so that I
mhm,
could be there in the NICU with my child. I saw so many moms and dads who had no paid leave, who were their kids are in there fighting for their life. They are struggling to recover. So those are the stories I think about that lawmakers, they're mostly a lot of men up here that they are not hearing these stories, women's health stories, women's lived experiences, Black women's experiences, and they need to be confronted with what folks are really facing.
mhm.
Because when they're making policy, they're not um, they're not having those stories front and center. And I think it's important for me to share that with y'all because it takes practice, it takes work to tell a
Mhm.
lawmaker about your mental health struggles or your pregnancy loss or other issues. But these are the stories that change hearts and minds for public policy to be better.
Absolutely. Absolutely. Thank you so much for sharing that. That's very important. And you're right. Storytelling makes a big difference. It actually puts faces and lives to data sets. So, my last question is a question that I've been closing every one of these segments out with. And it's not so much a question, but in in your own words, um, why does voting matter to our mental health?
Voting matters to my mental health because I know I want the safety net to be there when I need it. I want the hospital to be open. I want the doctor to be available. I want to be able to know I will have health insurance whether I have a job or not. And all of these things are actually related to who represents us in Montgomery and in Washington, D.C.
Mhm,
So for me, it's just a matter of I've talked to my elected officials. I know who's with me and who wants to be there to support me and my community.
mhm,
And I know that there are other folks who I think don't have my best interest at heart. So even though the election cycle can be really overwhelming and stressful, I know at the end of the day, my vote is my voice to, it's a chess move for the type of world I want to see. And so I've been surprised in the past that there were times that I never thought that the candidate I supported had a chance at winning.
mhm,
It doesn't matter to me. I think if all of those who are disenchanted by our electoral system would vote one time, we would be shocked by the changes that we could see happening. So I do think voting is power. It's one day. I hope you'll take the time to make a plan, um, and use the resources you that we have, that other partners have, to go cast a ballot for the type of world you want to see.
Yes, thank you. That's a perfect way to end today. So, thank you so much for being a part of this discussion, for being a part of the Voting Matters to Our Mental Health social media weekly discussions. Robyn, you and I are going to stay connected and keep trying to impact, not try and keep impacting our communities and our state and the world. So, thank you so much for being here. I appreciate you taking your time. And for everyone who's tuned in, remember to tap into these resources. Go to alabamaarise.org, learn about the organization, get connected, maybe join, get involved, and then stay connected to the Black Women's Mental Health Institute. Go to our website, Voting Matters to Our Mental Health. Remember, there are a lot of resources there as well, including some resources specifically about mental health care advocacy and mental health care policy. But there's also links like where you can check the status of your voter registration. I think some people are walking around thinking that they're registered and ready to go, and they're not. And what you don't want to do is wait till election day and find out. So go to the website, find out, check out your voter registration. If you're not registered, it'll show you where to go to register. Get involved, make you sure you're equipped. Like Robyn said, set a plan, and let's get to work because we have a lot of work to do. So thank you all for joining us. Thank you, Robyn. We'll see you next week.
Thank you.
Thanks. Thanks. Bye.